Before I introduce our speakers tonight, I'd like to say a really warm welcome and thanks for coming to this plant-based eating speaker series event. These are events that we have every month. And some of you are from the Plant-Based Eating Support Network group, and some of you are from elsewhere. So welcome to you if you are new to us. These monthly events are part of the Plant-Based Eating Support Network group, which is an online subscription-based group that provides ongoing nutrition and cooking support for people who are interested in learning more about the benefits and practicalities of a whole foods plant-based lifestyle. A plant-based lifestyle has so many benefits for our health, for the environment, and for the animals that we share the planet with. And there are so many incredible people working to raise awareness about these benefits that the speaker series is designed to bring those voices to the group. And I'm also pleased to be able to open these events to the wider community as well. We feature medical professionals, doctors, dietitians, nutritionists, naturopaths, as well as individuals who have inspiring change stories and groundbreaking and inventive chefs, which is always fun as well. And now we're going to talk about I'm going to talk a little bit about our featured speakers for this evening. You can see, I don't know if you see the same order as I do, but to my left is Dr. Zahra Kassam, and to my right is Michelle Fedele, who is a registered dietitian, and they are our featured speakers for tonight. They are the co-founders of PlantBased Canada and colleagues at the Stronach Cancer Centre in Newmarket, Ontario. So they're 3 hours, they're in their twilight hours of tonight. So we really appreciate them joining us here so late. They're both passionate about the role that healthy plant-based lifestyles can play in the prevention and treatment of chronic diseases. And together they are a powerhouse of amazing plant-based knowledge. Zahra is a radiation oncologist at the Stronach Cancer Centre and an assistant professor in the Department of Radiation Oncology at the University of Toronto. She received her medical degree from the Imperial College of Science, Technology and Medicine in 1995 and completed her specialist training in clinical oncology in 2006 in the UK. She undertook 3 years of additional clinical and research fellowship training in radiation technology at the Princess Margaret Cancer Centre in Toronto with a master's in clinical epidemiology at the University of Toronto. Her areas of clinical practice are in gastrointestinal and breast cancers. Zahra is also a certified lifestyle medicine physician with the American Board of Lifestyle Medicine. Some of you who joined us last month know that the speaker for last month was Dr. R.H.N. Kassam from the UK, and that is Zahra's sister. So what an amazing family making changes all around the world. And Michelle is a registered dietitian. She graduated from R.H.N. University with a Bachelor of Science in Human Nutrition and then completed her dietetic internship at the University Health Network in Toronto. Michelle is currently completing her Master's of Science, specializing in healthcare leadership. She has worked at the Stronach Regional Cancer Centre since 2010, and her clinical focus is on the importance of the role that nutrition holds through the cancer trajectory. She also sits on several provincial oncology committees with Cancer Care Ontario. Such a warm welcome to you both. What amazing backgrounds you both have, and we feel so lucky to have you here to speak to us tonight. Welcome.
Thank you for having us.
Yes, thank you.
So I wonder if we could get started by each of you telling us a little bit about yourselves and your vegan journey. How did you meet and start working together? And just tell us the story. Sorry, you want to go ahead?
Oh, you go first, Zahra.
This is going to take a long time if we won't start speaking. So I started off as an ethical vegan in around 2013, and as I was exploring that aspect, I came across the evidence-based benefits of plant-based nutrition for individual health and for planetary health, and so that's what opened up that aspect for me. I am lucky enough to have a wonderful family, 2 sisters who went vegan at the same time, R.H.N., who you've mentioned already, and my sister Layla, who works in the animal justice movement. And then of course, Michelle, who I've worked with now for 11 years, who's been, I'm telling part of her story, but I won't tell it all, but basically I threw myself at Michelle because Michelle was one of the few plant-based people that I knew. And we talked for years about doing Plant-Based Canada and something along those lines, and educating people, educating our health professional colleagues, educating the public. And then finally in 2019, we formed Plant-Based Canada and have started our activities.
Yeah, exactly. Like, lucky to be with Zahra almost every day. We get to see each other and spread the word, and everyone knows us at the Cancer Center as the plant-based eaters, and we're recruiting more and more, which is great. So it started for me, I was quite young. I turned plant-based around the age of 12. I've had some cholesterol and family history since I was under the age of 10. I went to sick kids like every 3 months to see a dietitian to help teach me and educate me on how nutrition can play a role in helping my cardiovascular health, even at the age of 9, 10 years old. And then at 12, I, through the research with the dietitian that I was seeing at sick kids and my own reading, back then there was no internet for me. I knew that plant-based was the way to go to help me stay healthy from a heart perspective. And now I'm almost 100 and I'm still plant-based and alive. And yeah, that's it. And I met Zahra, and we just, of course, our love for plant-based eating and the importance of nutrition and how it can make such a difference in somebody's life, even, that's suffering with cancer or any other illness or just want to be healthy. There's so much, and I'm sure all you share the same sentiment as we do.
So thank you so much. It's great to get a feel for where you're coming from. I just want to say to the members of our audience here tonight, I have a few questions that I'm going to ask these guys. But if you have questions, this is your opportunity to tap into two amazing experts. So please, get your questions ready. You can pop them into the chat box if you don't feel comfortable speaking them, but we'll also have quite a bit of time at the end for questions if you want to unmute yourselves and ask your question live. So just so you know, keep your questions handy. So can you tell us a little bit about Plant-Based Canada? What's it all about? And you touched a little bit on why you started it, but can you tell us a little bit more?
We started it for the intention of providing education. We found that our patients, our colleagues, just are not educated in the evidence-based benefits of plant-based nutrition. And Michelle and I felt uniquely placed to do that because of our interest, because of the profession that we're in. So the mission of Plant-Based Canada is to provide educational activities to show the benefits of individual health, planetary health, and for the well-being of all the life forms on the planet. We have an annual conference that we do every summer. We've had 2 of them so far, and we invite Canadian experts from all over Canada to provide really high-quality talks, evidence-based, mostly on individual health. We always have a talk on planetary health as well. Our next conference will be in May, last weekend of May, and we'll be including some aspects of food justice as well, which is so important and perhaps less well covered. We have a podcast that we release every 2 weeks, and Emma was gracious enough to be one of our guests and gave us a wonderful conversation. We accept any invitation to talk about plant-based nutrition. So that's basically what we're doing. Michelle, I don't know if you have anything to add.
Yeah, we have an Instagram and Facebook account. I post recipes. We have a Wellness Wednesday that we try to incorporate like healthy practices in terms of sleep and stretching and yoga and exercise. And I put in fun facts, and I feature my ever loving here cheerleader dog, Luna, who's in a lot of my posts and my taste tester for a lot of the recipes. So yeah, we just try to have fun with our Instagram posts, and I hope you guys check us out, because we'd love to get your feedback and comments. We love to chat with our followers.
And I would say we have the most amazing team that grew organically around us, and we can only do what we're doing because of them. And in fact, I see Laura, one of our team members, here today. So Laura, thank you for coming.
Laura should come on.
Yeah, Laura works in David Jenkins' lab at St. Michael's Hospital and is doing amazing work.
Wonderful. Well, we will grab her and get her to tell us about what she's doing as well here in a little bit.
Yeah,
Laura,
she's amazing. She's doing so many amazing things, and definitely she can be part of this conversation, putting Laura on the spot here tonight.
Wonderful. We had a quick question just about the conference. I know you told me earlier that it's virtual, but someone was asking a question. Anne was asking a question about where it is, and this is something that it's not just for medical professionals, right? It's for the public. So
that's right. We wanted to make it accessible to everyone, anybody who has any interest, and we try and make the ticket prices as low as we can to really just cover our costs, because one of the things that we found with the nutrition conferences, first of all, we didn't really have big ones in Canada. There is one that St. Michael's Hospital does in Toronto every year, and that's amazing, but it's not specifically plant-based, and that you'd have to go to America to get these big conferences and hear these people, but they weren't showcasing Canadians, and they were really expensive. So we really wanted to make it accessible. So we advertise that on our website, on our social media. You can sign up to our mailing list on the website as well, so you can get alerts as to when the tickets will go on sale. And because it's virtual next year, there's no limit. The first year we did it in person, we were sold out really quickly with a huge waiting list, which was awesome.
Yeah, we have no capacity, obviously, when it's virtual, which is great, and we can reach so many other people. I know for our Michael Greger conversation, we had people come out from the East Coast. Remember, they came out to see him, so that was nice.
We're big fans of Michael Greger here, so.
Yeah, he was with us actually just before everything closed down for the pandemic. Like, I think a week or two, he came to talk live, and then everything shut down. So we were able just to get him in.
We were the last talk he did before he had to shut his tour down.
Yeah, and he's done nothing since. I mean, there's nothing better than us. And then he just said, forget it. I cannot go on with my career.
I love it. Okay, so, well, maybe I'll bring Laura in here. I'm going to ask her to unmute.
Or Laura.
If she wants to. If you want to, Laura, you are welcome to, and I will add you to the spotlight as well here. I think I can do that.
Can you hear me?
I can.
Yes, I can.
Okay, sorry. I'm like on my phone, lying in bed in the dark because I just put my son to sleep. So I'm not like gonna turn my video on, clearly.
No problem. Why don't you just tell us a little bit, Laura, about what the work you're doing?
Oh, sure. So as Zahra mentioned, I've done my graduate work at the University of Toronto with Dr. David Jenkins, who's massive in the field of plant-based nutrition. So I did my master's and my PhD with him. So I was really lucky to be working so closely with somebody that is very, very much in this field, but it's just such an inspiration. And also like just so well versed in really strong methodology. So we've done a lot of really good work to demonstrate the health benefits of a plant-based diet. In particular, we work on the portfolio diet, which is a cholesterol lowering diet. It's in guidelines internationally. And now in my postdoc work, I'm working with another supervisor very close with Dr. Jenkins still, and we're working on a mobile app that we hope to have freely available for anybody around the world to use. We're starting beta testing now, and it's amazing, just people that stumble upon it from Canada, Europe to Australia that are just stumbling upon the portfolio diet online and are really interested in changing their diet for their health. So it's great to kind of hear the success stories kind of in the background. So that's like one of the more exciting things that I work on, and that is really closely tied in with PlantBased Canada. I work on other projects as well, but this is kind of where the bread and butter of my work.
That's awesome. That sounds amazing. And we'll have to have a look at that, the portfolio diet. And thank you so much for telling us about it. And we'll have to maybe have you as another guest on the plant-based eating speaker series sometime. I love this. This is amazing because normally, like I was saying to these guys, for 10, 15 years, I've been, kind of talking about plant-based eating and the benefits in our small BC town. And it's, and then we started talking about from people all over the world, but it's so incredible to have, know that we have all this amazing knowledge and stuff going on right here in Canada. So it's so exciting. Okay, let's get into the beans. How do you implement lifestyle medicine and plant-based advocacy? I know you both come from different perspectives, from the perspective of a physician and then the perspective of a dietitian. How do you guys implement these things in your day-to-day work at the Cancer Centre?
You want me to go first, Zahra? So with me, I have the incredible privilege of working with our cancer patients, and they are so motivated and looking for ways to be involved in their cancer treatment and in their journey, because they feel like, everything's decided for them, their treatment, their plan, so they don't have much control. So food is something you really can take a good hold of. And I feel that with nutrition, especially in the cancer world, I can definitely give a lot of assistance to symptom management throughout their treatments, whether it be chemotherapy or radiation. I'm also very much involved with the palliative care team because end of life, there's still a huge role for nutrition and helping with symptoms. And also I help the families who want to be part of this with their family member, and I help them with recipes and meal planning and how they can get involved. And definitely with plant-based eating, there's so much evidence out there, and I know I'm preaching to the choir here. So it's great to be able to teach not only our patients, but also all of their family, which will then lead to this cascade effect of the family taking on the plant-based lifestyle as well.
Absolutely. That's so powerful. What amazing, amazing work.
Yeah.
Sorry, do you want to go ahead?
Sure. So I have a big interest in lifestyle medicine, and we know that about 40% of all cancers are caused by our lifestyle behaviors. When we practice in the hospital, we're very focused on the treatments of chemotherapy and radiation. And, as I educated myself and found out all these ways that we can actually help ourselves, and as Michelle says, take our power back to help ourselves, there really is nowhere in the hospital, there's no program that we have that is educating our patients at this very teachable moment, and at a time when our patients are asking us for that sort of information. And so I really I think I'm one of the very few physicians that I know, oncologists, that actually I set aside 15 to 20 minutes of each new consultation to talk about lifestyle measures. So I talk about plant-based nutrition, I talk about the benefits of exercise, I talk about maintaining a good body weight, I talk about the link between alcohol and cancer, I talk about the benefits of good sleep and stress management, the benefits of vitamin D supplementation. And unfortunately, our patients are not getting it anywhere else. So I add that onto my clinic time. I do all my work that I would have done during that time at the end of the day. So because there's no other space to do it. And I hope that in that 20 minutes, I can spark something in our patients, because really we're not giving them all that information. We're not supervising them. We're not helping them implement those changes. So other than Michelle, who's addressing the plant-based nutrition piece of it, there's no mechanism to help them. So we have to empower our patients to take that on themselves and do it at home. We try and give them resources. Michelle has lots of great resources for plant-based nutrition, and we direct them to places like PCRM, the Physicians Committee for Responsible Medicine, and other online support that we know about. So that's how I do it. And I find that people are very open, just like Michelle has said, and it's a common question that we get about what can I do to help myself. And I also find that when I start talking about this with people, it really brings people's anxiety down. They're really grateful to talk about this and not just be focused on the big treatments of chemotherapy and radiation, which people of course understand the importance of. But they want to do this side by side. We tell them that it will help them cope with the side effects of their treatment. It will reduce the risk of recurrence. It will reduce the risk of new cancers coming. We know that unfortunately, if you've had a cancer diagnosis, you are at increased risk over the general population to develop a new cancer. You are more at risk of developing heart disease, the side effects of long-term side effects of the chemotherapy and radiation. So all of these factors will help that as well. And then we invite people to explore it more as they wish.
Okay, I think I saw a related question to this, exactly what you were just saying. I'm just going to pull it up from Kate. She says, I'd like to think we're in a teachable moment for physicians as well. Does Plant-Based Canada have a role in advocating for the education of doctors and other medical professionals?
Absolutely. That's a big piece of what we're trying to do. We do have a good network of, being a physician, being a dietitian, we do have our networks to advertise our conferences. So we're advertising to people who are not already plant-based. And we also have a growing network of lifestyle medicine physicians and other healthcare professionals in Canada that is growing quite well now. And in fact, I've been part of the working group for the Lifestyle Medicine Group in Canada. We've just formed a member interest group of the American College of Lifestyle Medicine. We had our first inaugural meeting yesterday, in fact, and you can really see that there are more and more people becoming interested in this aspect, but we obviously have to do more. It's a small group, it's a passionate group, but we have to do more. And we have started talking about how to get medical professionals educated. We've been talking about, lifestyle medicine interest groups at various universities across the country. Queen's University has it, and there was a lot of interest. So we're trying to work together with that group, the Lifestyle Medicine Group, to do exactly that. It's just so hugely important that we educate our health professionals, but also the public. And unfortunately, it's our public who are educating our health professionals as well. So it's a two-way street.
There's a lot going on I'm so grateful for the work that you're doing here in Canada with that. There's a lot going on as well with Michael Clapper in the US is doing a lot of work for in trying to educate doctors and physicians and other healthcare professionals. And of course, Shireen, the work she's doing at the University of Winchester in the UK that we heard about last month, it's amazing. So people it's all happening all over the world. It's pretty cool to see all these synergies and people, the things that are, even though we're not in the same country or town necessarily, we can support each other in this work. So important.
Yes. And in fact, the American College of Lifestyle Medicine, they also have the Global Alliance of Lifestyle Medicine, and you can see all the countries there who have joined. It is actually the fastest growing medical specialty recognized in the peer-reviewed literature as a growing and global specialty. So I think that is a cause for hope and excitement, definitely.
That is very encouraging to hear for sure. So and I don't know if this would be something maybe Michelle might want to address, but can you talk about some of the benefits that you've seen maybe for patients and their families when they do start to adopt more of a plant-based way of eating?
Sure. It's so amazing to see them on day one and then be with them throughout their journey at the cancer center. And I have some patients who have either a diagnosis that they're able to get treatment from, and then I have others who have diagnoses that are unable to get treatment. And both sides adapt this type of lifestyle along with the support of their family, whether the family 100% joins in or not. They start to feel really good. They can help manage their nausea, their symptoms, their bowels are working better, and therefore they're sleeping better. And when they sleep better, then their day is better, they're more clear. And that's what I'm looking for. And I see it in the patients, the clarity that they have. And instead of this kind of cancer blanket sort of fog that's over them. And when they have the ability to eat well, they feel well and they feel they have good energy, and that helps them get through their treatments. So it's quite amazing. And you can see it pretty much if they're from one cycle to the next. And I can definitely see the difference. And there's one gentleman I'm just thinking of. He's a pancreatic cancer patient who's undergoing, a strict chemotherapy regime. And on the first day, he's like, Michelle, I want to follow plant-based. Can you help me? So it was so great to give him all this education. And he came with all his snacks to chemo to show me everything. And he just says, I feel really good. I feel really positive. And, honestly, that makes me feel like I'm doing my job and helping them. I could become part of their family. You know what I mean?
That must be very rewarding. Zahra, do you have anything you want to add to that?
I've forgotten the question already. I'm sorry. I was so engrossed in what you were saying.
That's totally good. Okay. So our theme in the Plant-Based Support Network group this month is hormone health. And I wondered if one or both of you would be able to talk about how a healthy diet can impact our hormone health, both for men and women.
You want to talk, Zahra? We were just talking about
and then you can take over. Obviously this is a huge subject, and we could talk on many different aspects of it. We know that plant-based nutrition definitely affects our hormone levels, whether it's our estrogen levels, our insulin-like growth factor levels. So we can say that in the cancer world, we believe that impact of plant-based nutrition can help in that way reduce risks of certain types of cancers. We know that plant-based nutrition can help us keep our body weight under control, which also affects our hormones. If we are overweight, we have high levels of estrogen, high levels of insulin-like growth factor. If we're meat eaters, we have high levels of insulin-like growth factor. So all these conditions will promote cancer growth, because these put us into a proliferative state. So there is that cancer aspect as well. So we believe that that's one of the mechanisms that plant-based nutrition can help reduce cancer risk by altering our hormones. When we have a lot of fiber in our diet, we can help eliminate estrogen. So that aspect is very important. We can talk about women's health as well. We know that, we've had great data from Physicians Committee of Responsible Medicine to show that a low-fat vegan diet can help us with premenstrual symptoms, and they've done randomized control studies in that. We've seen randomized control studies in perimenopausal women to help with menopausal type symptoms, and showing that low-fat vegan diets with half a cup of edamame every day can significantly reduce your risk of hot flashes and eliminate severe and hot flashes in about 60% of people, and reduce it in over 80% of people. So we have lots of good evidence like that. I don't know if there are any specific questions around hormonal health. And of course, PCRM Dr. Neil Barnard has got that book, Our Body in Balance, which is amazing. There's a couple of great people in the UK. You should get on your speaker series if you haven't already. Rahini Bajekal and Neetu Bajekal, who do female health, and have written a book which is coming out called PCOS, Polycystic Ovarian Syndrome. We know there's more and more data on plant-based nutrition for people who suffer from polycystic ovarian syndrome, which is actually affects more people than menopausal symptoms affect. So it's a big problem. So we have lots of great data coming out now. Michelle, you take over now.
And for sure, and I see a lot of the women who are breast cancer survivors and thrivers and get pushed into menopause early, and I'm able to help them manage their weight as well, because a lot of them put on a lot of weight, which is quite disturbing for them, and it happens really quick. And so I'm able to work with them to incorporate plant-based foods, and like Zahra said, amami, flaxseed, all these things can help with hot flashes and these symptoms that they've never experienced before, and it happened overnight. And definitely the weight gain and helping to get their bowels working properly, have good gut microflora, which you hear all about the importance and how that makes such a huge difference. And definitely plant-based eating and having, good, healthy pre and probiotics will make such a difference. And both I see for the prostate group as well as the breast group. And I also work a lot. It's interesting. I was talking to this patient who's a mom, who's a breast cancer survivor, and who has young daughters in their lives who are starting their menstrual cycle. And they have they have 3 girls in the house. 2 went plant-based and 1 didn't. And the 2 who went plant-based had less cramping, felt better, less mood swings, all this during their time of the month than the one who wasn't. And the girls who went plant-based said to the other sister, well, if you just ate more what we ate, you wouldn't be having your bad cramps and everything. So it was great to see how it trickled down to the whole family.
That's quite that talk about a good live time example, right? Yeah. That's really cool. And I think the really hopeful thing about that too is because so many of us or so many people sort of come to this as a reactive measure, and so it's wonderful when you can get it into the lives earlier and use it as a proactive thing. It's such a healthy way of living. Thank you. If anybody does have, I know those of you we just started our Hormone Health Month, and we definitely will be talking about Dr. Barnard's book and some of the things that Zahra mentioned. But if you guys do have specific questions to do with hormone health, be sure to stick them in the chat box, or hold on to them for our question period here. So Zahra, I know one of your area, and maybe you don't have, you've touched on this already, so I just want to make sure I'm not missing anything, but I know one of your areas of clinical practice is breast cancer, and I wondered if you could talk about the effect that a whole foods plant-based diet can have on breast cancer prevention, recovery, and recurrence specifically.
So definitely, so lifestyle measures, we did mention that about 40% of all cancers are related to our lifestyle. For breast cancer, it's about 26% is related to our lifestyle. And of that, plant-based nutrition plays a huge part. We definitely have data from really good prospective cohort studies showing that people who have a more plant-based diet have a lower incidence of breast cancer. We know that from the big studies like the EPIC Oxford and the Adventist Health studies, which did have groups of vegans and vegetarians in them. We also know it from other prospective cohort studies that don't have specifically a big group of vegans or vegetarians, but have used plant-based dietary indices to categorize how people are eating, and then also showing that you can reduce the incidence of breast cancer by a more plant predominant diet. So we can reduce the incidence. During treatment, we can see that having a more plant predominant diet can help people feel better. Michelle's already touched on that in the previous question. And we also have data in the survivorship area. So after treatment, that the more fruits and vegetables you eat, the lower your risk of breast cancer recurrence. We have data in whole grains and beans and other legumes. So all of these have independent effects in reducing the incidence and recurrence of breast cancer. And I'll just give you a couple of examples in that space. So we know the data on soy. So we have many studies now from different places in the world with thousands of women showing that soy intake, 1 to 2 portions a day for minimally processed soy, such as edamame, tofu, tempeh, soy milk, miso, can reduce your risk of breast cancer coming back. And the numbers vary from like 20% to 40% to 50% reduction just from doing that part. So we also have a recent study that just came out this year showing that nuts reduce your risk of breast cancer recurrence after a breast cancer diagnosis. So there's a number of studies showing us that this is really the best way of eating. We have data in looking at saturated fat. So we know, of course, we all know that saturated fat is our bad fat that comes from any animal product, dairy or oils. And in the breast cancer literature, we can see that if you have a diagnosis of cancer, those people who are having a higher saturated fat diet have an increased risk of breast cancer recurrence. So we definitely can say very strongly that a plant predominant, low saturated fat diet really is the most optimal for doing well after a breast cancer diagnosis. And in addition to that, all the other lifestyle measures, we have great information, great evidence showing that exercise can reduce the risk of breast cancer recurrence by up to 40%. We have evidence of stress management and mindfulness about helping people get through treatments. So we also have evidence on vitamin D. Once you have a cancer diagnosis, optimal levels of vitamin D can reduce your risk of breast cancer recurrence and other cancer, doing better after other cancers. We have actually the most expensive randomized control study from the Women's Health Initiative looking at nearly 50,000 postmenopausal women, and they looked at diet specifically, and they got one group to eat as normal and the other group to have more fruits, vegetables, whole grains, and a lower fat content of their diet. And that group had a much lower risk, well, about 10% lower risk of dying from breast cancer and from heart disease. So we have so much evidence pointing in this direction.
Thank you. Thank you. It's great to hear those, that sort of scientific information, that the proof is there. It's not just that we think it makes us feel better. It actually does. That's great. Thank you. Michelle, you're also involved as an advocate for optimal nutrition for children, and you help to facilitate a healthy school program. Why is it so important to teach our children about nutrition early, and what are some of your favorite strategies for getting kids interested in healthy foods?
Yes, it's one of my passions is to work with the little ones. They're so much fun and they're so eager to learn, and they will direct, and I'm sure many of you out there who have packed lunches, if you do it wrong, it will come back the way you brought it there to school. So it's great that I had the opportunity, in my daughter's school to get involved, and we ran programs with the parents. We had like healthy school nights. So in the parents, I had them with a chef, and we were teaching them how to prepare healthy plant-based meals while the kids were working on physical activity, because we all know, especially over COVID, everyone's on their screens and the children are working out and exercising and having fun. But also, I think if I think of something positive that's come out of this time is that we've got a lot of families working together in the kitchen and teaching kids early on the skills to be in the kitchen, working with knives, how to cook, how to do this. It really is such an amazing opportunity. And, being a child that was involved with dietetics so early on, I have this passion. I've learned so much so early, and I'm so blessed to have been able to get this knowledge of being plant-based. I was probably the lone ranger, late 70s, early 80s in Scarborough. Nobody was plant-based. And I was by myself, just eating bagels and margarine because there was nothing else. And, you know, I really evolved from that. So I think the more power that I was able to teach the children, they went home with the information, which empowered the parents. Because if the child's not going to eat, you know, the parents are going to try to do what they can to get them, you know, involved and not bring that lunch back exactly the way they packed it for school. And they're so interested, you know, it's so much fun to work with them. And, you know, I'm the only one in my family who's plant-based. My daughter does definitely eat a lot of plant-based foods, but my husband is not plant-based. So it's always interesting. People say, well, how am I going to, you know, cook plant-based for my children when, you know, my husband doesn't eat, you know, eats meat, or, you know, we have multi-generational families. How can I do this? And I say, listen, I live this, it's possible. And it's interesting that my meat-eating husband, who is Argentinian and all about steak, actually admitted to me that the vegetarian and plant-based foods are more flavorful and he enjoys it more than when he eats a steak. So that made me really excited. So.
There's still hope.
There's still hope. Yes, I really would be shocked if that ever happened. But
well, on a personal note, my husband was, we've been together for about 30 years. And for the first 15 years, he still ate meat when we went outside, when we went out to eat. And then he read the China study and now he's vegan. So there's always hope.
There's always hope. Yes. But, you know, definitely working with kids and starting them young and understanding the benefit of nutrition and how that can help them, you know, do better in their studies, help them play outside with their friends and have more energy and sleep better. And they love talking about poop and going to the bathroom. And I tell them to look at their poo and tell me what it looks like. And, you know, they think it's so much fun, but it's so important to teach them not to be comfortable to talk about bowel health, which really, you know, if you're not having a good bowel day, your whole day is ruined. So it's helped to teach the kids early about hydration. And they're such a great group to work with.
Yeah. Oh, that's really cool. Thank you for sharing that. I'm going to, we're at about 15 minutes and I want to make sure that we have time for everybody's questions if other people have questions. So I have more questions that I can ask if people don't, but I see there's one that came in from Shauna. Can a plant-based diet help, I think she means diverticular disease, which affects so many people as we age?
Yeah, for sure. You know, a lot of people worry if they have diverticulitis or diverticulosis, how could they be plant-based? It's actually so much better to be focusing more on good, healthy fibers and plant-based diet to help your bowels move and for nothing to get stuck and have parties in those polyps. So it's good for it to move through, and it's actually so much, it's beneficial, and they're not contraindicated. You know, and a lot of people are worried about including the legumes and including those things in their diet, but it's actually, I think, a better way to go. And at the Cancer Center, as Zahra knows, my nickname is Diarrhea Lady, and talking about bowels and everything. So it comes up a lot with diverticulitis and of course, our colon patients and our rectal cancer patients. It's really makes a difference, and they actually start to feel better and feel more in control of this disease that they live with, right? Because diverticulosis won't go away. It's kind of, you know, what you have to deal with. And same with Crohn's and colitis that I work with those patients too.
Great, thank you. Does anybody else have questions at this time? If you guys do, please feel free to unmute yourself and ask them yourself, or just stick them in the chat box. Give you a second. Seeing any raised hands.
I have a question.
Oh, go ahead, Nikki.
Can you hear me? Oh, okay. I just wanted to know, you guys have said so many lovely things, and I don't really have a specific question with regard to certain resources, but I was talking to Emma earlier this week, and I was just wondering if you guys have any recommendations for any kind of like documentaries or any of those kind of resources that, because I love documentaries, so, or just something that I can read or watch. That would be great.
Oh, there's so much. And in fact, if you head over to our resource section on our website, we have them listed there. So some of our favorites are Forks Over Knives, What the Health, Game Changers. The Invisible Vegan. What other ones, Michelle, have we forgotten on the document?
I've seen Seaspiracy.
Oh, yes.
That's an excellent one. That's fantastic. That documentary, by the way, has transformed my neighbor to be plant-based. So she called me after watching that. She's like, "Did you know?" I'm like, "Yeah, I did." And she's like, "Oh my God."
That's from the same people who did Cowspiracy and What the Health.
Yes, it's so excellent, and it blows your mind when you watch it.
Yeah.
And
Thank you.
And the one that my sister is in is, my goodness, eating your way to extinction. She's just
yes.
Oh my goodness, Emma, did she say something in her talk with you?
Sorry?
Is she watching now?
Your sister?
Yes, and I've forgotten the name of the documentary.
I'll
I'll send it to you afterwards.
Eating Your Way to Extinction sounds familiar.
I
Yeah.
think that's what it is. Yeah.
Yeah, something like that. So I've put the Plant-Based Canada website in the chat for anybody who wants to have a look. And all your social media is at Plant-Based Canada too, right?
Plantbasedcanada.org.
Okay.
Yeah, and you can find us on Instagram and on Facebook, and definitely reach out. You can ask any questions. Anything you want to see, anything you want to see me cook, or anything you want to see Luna do. She's always here.
Oh, excellent. Well, we'll have some suggestions for you for sure. So Shauna is thanking you for your answer to her question. And she says, how do we find out how to start on our plant-based journey?
There's so many great resources that obviously I didn't have as a little one in Scarborough with no internet in the early 80s. There's so many great books and resources out now. It's just endless, and there's such great ways to get started. And there's a lot of great dietitians who are out there who are doing amazing things out there to help patients get started. Lauren McNeil, she was on our podcast and on our conference. She's amazing. She does great work too. Shout out to her if she's listening. Tasting to Thrive is her Instagram thing if you want to check it out. And she has that plant-based for fundamentals that might be helpful. Tasting to Thrive, Emma, that's right. Of course, there's a great books with Brenda Davis, who, funny enough, she was the first one I went to. I don't know if anyone here is from Toronto or Scarborough, but I took the bus to Fairview Mall Library, and that's where I got the Becoming a Vegetarian book back in the 80s, and she was my inspiration. So there's a lot of great resources and great websites too that you can go on and have great recipes. A website that's not predominantly plant-based, but very much plant-based is American Institute for Cancer Research. Is a great website, amazing recipes, and all their information is evidence-based, which that's kind of what Zahra and I always talk about. You want to go to places that are evidence-based, that are not going to try to sell you something, or you need special vitamins or protein powders, which you don't. And we were just talking about it today that, someone was shocked that, our iron levels are so amazing. They just assumed we would be a disaster because we're plant-based. But like I said, I'm almost 100. I'm still alive. We can totally do this with food. Zahra, I know you probably know so many other resources too.
I would say a couple of things. One, go to our website, because we've got all the websites that we like, we have listed on there. And also something that people find very helpful is a more kind of supportive. So just, Emma, you're doing exactly that. And there's a 21-day plant-based challenge that my sister's group do. So you can sign up for free. So that's Plant-Based Health Professionals UK. So they'll send you daily emails. You're able to ask questions. So there's a little support group together with that. PCRM, Physicians Committee for Responsible Medicine, also have a free 21-day challenge to help you. So some people find those very effective. 21-day kickstart. Thank you, Emma. That's exactly it. Yeah. And of course, Emma, you're a Food for Life instructor. You know all these answers already.
Yes. And also, in your neck of the woods out there in BC, we have Dr. Pamela out there who's an amazing dietitian who does a lot of plant-based work. So I'm sure you are all familiar with her out there. So there's a lot of great resources.
That's Pamela Ferguson.
Ferguson, yeah.
Right. Yeah, we haven't had Pamela on yet, but we had Brenda Davis on, which was amazing. And Pam Ferguson, she's on Instagram. She does a lot of a great Instagram stuff. But there really are so many resources to get started. And I think one of those kickstarts that Zahra mentioned are a wonderful place to start, because if you're completely new to this, my feeling is that, sometimes it can be overwhelming because there's so much out there. And so if you take a 3-week kickstart, I think both of the ones that are mentioned here, the PCRM one and the Plant-Based Health Professionals UK one, they give you the recipes, the shopping list, like everything you need to just start. Very simple. They're all whole foods, plant-based, so you don't have to worry about does this fit in or not. And then you can try it for 3 weeks and just see how you feel. So that's an excellent, way to start. And then from there, if you start looking around, you'll just find there's so many wonderful resources.
For sure. And having someone who's a health professional or a dietitian and knowing that you're getting the sounded like advice what works for you and that you're not missing any nutrients and you're doing this in a very well planned, organized way, then, you might have some people in your family or even your family doctor who might say, oh my gosh, you can't do this. And, you're going to need so many supplements, but that's your opportunity now to provide education to the other healthcare professionals that you deal with. And that's what Zahra and I do all the time at work. Just that we always feel that we would want to get into every university and talk to every medical student program and help educate them, because that's what the patients go to the physicians primarily to ask for advice. And they need our support, because they don't get a lot of nutrition education themselves.
With the evidence, like all the evidence, especially around breast cancer that you were talking about, Zahra, do you see a shift in the medical community and the people that you're working with? Are people more interested in sort of, I know that they have a million things on their plate every day and learning about nutrition maybe at the bottom of the list, but is there a sort of at all a shift in that direction?
I don't know, to be honest. I mean, as a physician, there's just no time to think during the day, and you have very short appointments. You've got to get through talking about the radiation, the chemo, whatever it is, those medical aspects. So unfortunately, we're so resource strapped. There really is no space to talk about it. And then, as Michelle mentioned, there isn't any formal education in nutrition. There still isn't at most medical schools. I don't know, Michelle. I
don't know. I mean, I'm biased because I feel at our cancer center, they're very open to myself and my colleague getting involved, and they reach out to make referrals. And so that's when, I swoop in and try to help out. And, a lot of times the physicians I'm working with, of course, besides Zahra, want to ask me questions about the nutrition, or what about eating this, or what about doing this. And it's amazing how I was even working with one physician working on his kind of nutritional issues. And now he starts speaking more about it with his patients because he started to live it himself, that it does work. So I think it's going to take time. I think we're way better than we were when I started as a dietitian now 21 years ago, when there wasn't much interest at all, really. I was just thought of a person handing out insure. That's all that I was thought about, but now there's so much of a role. And I think a lot of people want to know for their own personal life. So I think a lot of physicians are asking me personal questions for themselves, to be honest.
Yeah. I think that, we have one more question. So I've read that food can contribute to inflammation. Does a plant-based diet address that as well? Great question.
Absolutely. I mean, inflammation is thought to be, the core mechanism by which is part of all the chronic diseases. And, we have, so in a plant-based diet, you have phytonutrients, anti-inflammatory and antioxidant properties. So definitely that's the best diet from that perspective as well. You know, a meat-based diet is pro-inflammatory, absolutely, and we have good mechanisms behind that. So absolutely key. It's absolutely key. And Michelle's already mentioned the microbiome, about how it keeps the health of the microbiome and reduces inflammation that way as well. So absolutely.
Yeah, and definitely it helps with, you know, a lot of my patients who suffer from rheumatoid arthritis, who have issues with gout. It just goes on and on about all the ways that it can help anti-inflammatory. And I do have physicians who recently come up to me and ask me for their own issues, and then they start to talk to their patients about it too. And, you know, you can feel relief from these symptoms pretty quickly, especially from our arthritis group. And I know at our hospital, we had a arthritis program and a dietitian who worked there and definitely talked about anti-inflammatory foods. And we all know, you know, when I think about my husband, you know, the meat eater, we'll talk about him for a second. He feels unwell when he eats all that meat. You know, his gut doesn't feel well. He feels sluggish. I tell him he has the meat sweats. Like, it's this whole thing. And then when he switches over and starts to have more pre and probiotics with food and eating well, he actually feels better. So it's instantaneous, and it's amazing how you can get that response from your body so quickly. And especially with cancer, of course, that is the underlying boiling water under there, that inflammation that's there, that we can really work on. You know, it's so easy to take control of it ourselves, you know, and we just try to look, and I think a lot of our patients look for this magic thing, like, if I just bought this supplement, then I'm going to be just fine. But it's really a whole lifestyle. It's not just eating. It's about physical activity. It's about sleep hygiene. You know, it's about being mindful and reducing stress, and, you know, kind of doing things throughout the day that serve you and make you feel calm. And, you know, and I think COVID taught us a lot about that stuff too, I feel, in people's homes, but that's just my 2 cents.
All the pillars are important. Yeah, we talk about that a lot in our group as well. So there's a question from Lisa. Can you eat turmeric while you're on tamoxifen? That's a specific question. Do you guys know, would you have thoughts on that?
Yeah, I can, do you want me to say, Zahra? Yeah, I say it's fine. I mean, I'd rather you cook with it and use the natural form of it than taking pills of it, because it's so much enjoyment for me to put the turmeric in the food and have it. The only time we talk about not having extreme amounts of antioxidants, like if you're putting piles and piles of turmeric and stuff, is when you're ongoing through treatment. We try to just watch that a little bit, but after treatment and moving forward, we definitely work on antioxidants and known anti-inflammatory spices and foods. And we've learned so much, and there's so much more to learn from other cultures that have done great years and centuries of this work. So yes, we don't say it's an issue. So.
And I think we perhaps just to mention that, you know, there's a difference between meeting your nutritional requirements and having all these excellent things in your diet. Difference between that and supranutritional doses of supplements. There is no evidence that supranutritional doses of supplements benefit you or reduce your cancer risk. So other than vitamin D, there actually could in fact be harm from taking supplements. So for example, beta carotene, you know, it was found that carrots could reduce the risk of lung cancer, but then if you isolate beta carotene and give that as a supplement, they actually found it increased the risk of lung cancer. Or vitamin E at supranutritional doses increase the risk of getting prostate cancer. So we're very careful about supplements, and Michelle has mentioned that a few times, that we're just talking about getting the best from your diet, not getting supranutritional doses elsewhere.
Exactly. And, you know, more isn't more. And I think people in Costco, I mean, you see these mega things of supplements, or you go to the health food stores and they try to sell you things. You know, you don't need all that stuff. And, you know, look, I've been plant-based for so long, and my only supplements I take is a B12, I take vitamin D, and I take like an omega-3, but from an algae source. And of course I add flaxseed to everything. And my hemoglobin is perfect. My iron level is perfect. So it's not that I'm doing anything super special. I'm just having a well-balanced, planned out plant-based diet. And that's why if you want to do this, that's why those 21-day Kickstart programs will be so great, because it'll teach you what nutrients to look for. You know, don't get swayed, you know, from people saying, oh, you're going plant-based, then, you know, you're going to be deficient in zinc and calcium and all this, which is the complete opposite. So definitely, of course, you know, tailored to your own specific healthcare needs, but you can definitely do this. You don't need to buy super amount of vitamins.
Thank you. That's very much the message in that I promote in our group as well. So it's so thank you for that. We are at 6 o'clock. So we do have, I think the question that just came in, you actually probably have pretty much answered, just in terms of, let's, we're getting a couple more questions. If you guys don't mind, do you mind staying on for a couple more minutes?
Not at all.
Sure, go ahead.
Okay, so regarding supplements, is vitamin C and zinc and probiotics bad if you're using them for immunity, especially if you're not yet 100% plant-based? I think you did answer this question, but I don't know if you want to say anything further about that.
Well, like super dosing, so, you know, I experiment on myself so I can be honest with you. So if I super dose, let's say, for example, B vitamins, I'm just going to pee it out. And if you ever do that and take more B12, or I take more, you know, B1 or this, and I go and I see my urine is like highlighter yellow, because your body is so efficient, it knows what it needs and what it doesn't. So taking extra vitamin C with pills, but you can just eat the food and have great vitamin C from not only fruit, but vegetables too, then your body will use it what it's needed. It's very smart, the body, and I think we underestimate it. And you'll notice in your pee that you have overdone it, because you're just peeing literally all your money down the toilet. So in times of, you know, COVID and flu season, you know, people want to start taking like mega doses of zinc and vitamin C and everything, you know, like vitamin D, absolutely you have to do that. And clearly I don't get any sun, so I have to get a lot of vitamin D intake, but, you know, you can get from nuts and legumes. There's so much opportunity to get the zinc and the vitamin C that you need from food. And then you feel full and satisfied, and that's going to help with weight control. And that's going to help your bowels. You know how meat and bowels are best friends. So I'd rather you do that than super dose on these Costco size vitamins, you know?
And then just to add extra on the probiotics, you know, the gastroenterology associations now say there is no evidence for benefit of probiotics for general use outside of a clinical trial. So you can get your prebiotics and probiotic foods from your diet. We do not recommend you take probiotics, both from cost and just inefficacy. And we don't even know what we're doing. You know, it's based on, you know, little evidence, no good evidence to support any benefit there.
Yeah, and some can be very costly, as you probably noticed. They vary differently, whether they're in the refrigerator, they're definitely more money. And then if they're not in the refrigerator, but you can get that definitely through your food, and apples and bananas is just, it's amazing how people underestimate the power of food.
Absolutely. I think the big message, the big take home message is it's all about the whole foods, the whole plant foods. Thank you so very, very much for your time tonight. We have learned so much from both of you, and got so many great tips. And I think we've got almost everybody still left on the call. So everyone's thank yous are coming in fast and furious. Thanks to all of you guys for coming and for all your wonderful questions. If you are interested and you're not already in the Plant-Based Eating Support Network group, this is a group that provides ongoing support for people who are transitioning to a plant-based diet. So please, I'll send out a follow-up email with all of that information, as well as the information for Plant-Based Canada. And just as a little, Zahra and her sister R.H.N are coming out with a book very shortly. So that would be something to look up as well, another wonderful resource. And it's great to have you here tonight. Everybody, thank you again for your time. So very much appreciate it.
And thanks, Laura, for popping on.
Yes, thank you, Laura, as well.
And thank you, Emma, for the honor of inviting us here. We're very happy to be here. And thank you for everyone who tuned in to listen. Thank you.
It's so nice to see you all. So
have a good night, everybody. Thanks for coming. Bye for now.